Yeah, thank you very much, Mr. Chairman. Ladies and gentlemen, first of all, I would like to thank the organizers for inviting me to present this talk. And there was now requests for rational therapy. Let's start with that, because something is available. Question is, does it really work? Is it fact or fiction? But before I go into more details, let me give you some physiological background of the sperm cell. Sperm cells are actually very unique cells in the body. It's not only the smallest cell, it's also the most polarized cell. And therefore, for this high polarization, they need an extraordinarily high amount of polyunsaturated fatty acids in the plasma membrane. You can see here these double bonds in this molecule here, and here's unsaturated. Here's, sorry, saturated, here unsaturated. And these double bonds actually make these sperm cells very susceptible to oxidative damage, to oxidation. And if this happens, this molecule will turn into such a molecule, and thereby the fluidity of the plasma membrane will be damaged, and the functionality of this cell will also be damaged. So there's a high risk of oxidative damages, which we call lipid peroxidation. In addition, these sperm cells, like you see here, they do not have much of cytoplasm, which actually contains antioxidants and antioxidative capacity. So there's an inherent deficiency of this antioxidant capacity. And there's also a limited capacity of repair abilities for DNA. So if we now expose these cells to oxidative stress, then we see problems. But what now is oxidative stress? It's actually an imbalance between oxidation and reduction towards oxidative status. So it's out of balance, and then this is triggered by reactive oxygen species, which is chemical intermediates, which you can see here. There's different types of reactive oxygen species available, which have reaction times between nanoseconds and milliseconds. And here, just an example, hydroxyl radical. It's an extremely strong oxidant which reacts actually immediately at the site of production. On the other hand, here we've got hydrogen peroxide, which can even penetrate the plasma membrane. So if it is produced outside of the cell, it can penetrate the cell, the sperm cell inside, and can then damage the DNA. But where are these reactive oxygen species now coming from? And they now become to different sources. Number one, there's primary pathologies of the male reproductive system, including infections, abnormal sperm, age-related errors, prolonged stasis of a sperm in the transit, also defects of spermatogenesis contribute to reactive oxygen species production. Then there's systemic pathologies, diabetes. Nobody thinks that this is actually causing a systemic inflammatory response. So in fact, in diabetic and metabolic syndrome patients, these patients actually suffer from high levels of oxidative stress, in the end causing fertility problems. Cancer, systemic infections, and also varicocele. In addition, our modern lifestyle is actually counterproductive to reproduction. Because if we now look here at occupational factors, smoking, drugs, radiation, scrotal heat, pollution, all this contributes to poor fertility and to, in the end, oxidative stress that these cells, these extremely sensitive cells to these highly reactive molecules are exposed to, and then causing sperm dysfunction, including DNA damage. And this is where we have to now intervene. Evaluation of oxidative stress, and of course, if it is oxidative stress, fine, we've got antioxidants. Treat the patients with antioxidants, but there's a big but. Oops. What is really going on? What are we doing to these patients? If we now link these conditions to oxidative stress in male reproduction, male infertility, sperm DNA damage, lipid peroxidation, and so on, always we know. But what are we doing? in about 25 to 40% of the patients, we will find high levels of oxidative stress, even here up to 60%, with higher levels of reactive oxygen species found in the semen. We treat the patients with antioxidants, fine. What kind of antioxidants is actually normally available? This is a question that we have to ask ourselves in the normal semen, because if that is a very sensitive cell, some protection should be given and provided by the organism. So there's dietary antioxidants like vitamin A, B, C, E, and so on, even flavonoids. There's also endogenous antioxidants in the seminal plasma like superoxide dismutase, or non-enzymatic antioxidants here, urate, pyruvate, and so on. All this is known. But the spermatozoa themselves, only enzymatic antioxidants, superoxide dismutase, not even catalase. Also available metal binding proteins like albumin, ceruloplasmin, and so on. But where can these antioxidants in fact work? There's three concepts. We can prevent the production of these reactive oxygen species. We can intercept by scavenging or just chain breaking the damaging processes, or in the end, if there is some damage occurred already, we can try and repair the DNA or the protein turnover. How can this be done, and where is the connection now between oxidative stress and sperm function? All of us know that oxidative stress is actually damaging and to sperm functions, motility, acrosome reaction, zona binding, DNA fragmentation. But on the other hand, each and every cell, including spermatozoa, they need a certain physiological amount of reactive oxygen species to function normally. So it is in the end the balance of this antioxidants and oxidants. And with our modern lifestyle, the balance is rather put onto the oxidative side. So this balance is out of balance. It is on the non-physiological side where the sperm functions are compromised. So if we now want to treat these patients with antioxidants to bring the balance into balance again, what are we using? We are using vitamins. Lots of vitamins, vitamin C, vitamin E, carnitine, selenium, carotenoids, glutathione, coenzyme Q10, and trace metals. With all beneficial effects, yes. But coming now to studies that have been performed. And you can see here over the years, it started actually here in Italy with Andrea Lenzi, who did the first study with glutathione. And green indicates studies with positive effects. Red indicates studies where negative effects on different functions could be found. So it is actually quite different, positive and negative effects. Afterwards, just recently, Ross and the Aitken group did studies and evaluated these studies that were available. Out of 13 out of 17 studies reported improvement of at least one semen parameter. 6 out of 10 reported improvement of pregnancy rates. And this is what US gynecologists and embryologists are actually looking for. In the end, will the couple fall pregnant, yes or no? Other studies here, 70% decrease of reactive oxygen species and DNA damage. Similar problem here, but Aitken and co-workers, when they actually looked at placebo-controlled studies, and this is a problem. Such studies are not readily available. Only 11 out of 20 were placebo-controlled. 13 out of 20 were randomized. Others were even not a follow-up. So we sit with a definite problem, and if we now look what is the effect of these antioxidant treatments on certain parameters of sperm. We find here 3 studies couldn't find a positive effect on sperm quality and pregnancy rate. Here it's 6 studies, no effect on motility. 10 out of 15, which is 2/3, no improvement in sperm concentration. However, all of them improved for oxidative stress. The general problem of all these studies, it is small studies that were available, no restriction to inclusion and exclusion criteria, varying endpoints. This is also pointing to what Chris said, there's even different test systems involved. Only very few placebo-controlled studies. Antioxidant defense system of sperm is very little understood. We still don't know what is really going on in the semen, in the sperm cell, and in the female organism. On top of it, there is a huge problem and concern that we can actually raise marketing strategies for antioxidants. How many of you are taking vitamin tablets and antioxidants and anti-aging tablets? All of these anti-aging tablets contain vitamins. And which doctor is asking the patient, what kind of tablets are you taking there? There's a problem. We must think about that. In the end, this will be leading to uncontrolled intake of antioxidants because we don't know what is really going on. There's more problems. Different antioxidants are even used. Vitamin C, vitamin E, sometimes supplemented with minerals, various dosages, various durations of a treatment, and seminal antioxidant capacity is not tested. We all test for sperm functions, motility, DNA fragmentation, maybe some labs test for oxidative stress in the semen, but what is really the antioxidant capacity? We don't know. The patient might be even overdosed. If you consider the unknown intake of antioxidants. Now we must talk about the so-called antioxidant paradox. There is people with diet rich in fruit, they have decreased risk of getting cancer. However, supplementing these patients with vitamin A does not have any anti-cancer effects. It's rather the opposite. If we think of fruit consumption decreasing oxidative damage to the DNA, on the other hand, supplements of vitamin C and E does increase the risk of DNA damage. So what are we talking about there? This is the question we have to ask. If we now look at the normal physiology of cells, we must know that a cell is rather working properly at a rather reduced state. At a rather reduced state, not at the highly reduced state, nor at a highly oxidized state. This redox status, indicated here on the left-hand side, triggers certain physiological reactions in the cell. For instance, if we now move this cell to oxidative status, apoptotic mechanisms might be shut down, and then damaged cells can reproduce themselves, causing cancer. If we now go to the opposite side and shift the whole to a reductive state, then these cells are not even able to induce apoptosis. So they also can derail and induce cancer. So it is really very much about a balance. And coming now to fertility again, we have a lifestyle producing high numbers and high amounts of oxidants, lifestyle infections, lack of antioxidant capacity, which we don't know at the moment. So if that is the case, the balance is going towards oxidative stress. And this is what we all hear about in the literature, what we are talking about. However, now our rational treatment approach is treat the patient with antioxidants. Fine, the balance is coming into the green areas again. Patient should be normal and should be fertile. However, if we overdo, we sit with another problem. When we come to a so-called infertility due to reductive stress, and reductive stress is again as dangerous as oxidative stress. So what we see there in the literature with studies showing positive results and negative results can be an effect of not knowing what we are doing there. So from a patient with oxidative stress, we put the patient into reductive stress. And this reductive stress is actually defined as excessive amount of reducing equivalents in form of NADPH and or glutathione. And this is, in the end, changing the cellular redox system and affecting physiological functions like DNA and RNA synthesis, protein synthesis, and so on. And we must know that reductive stress can even cause diseases like heart disease, neuronal death, and poor embryo development. This is fact. So coming to the conclusion, antioxidant therapy in the man, does it work, fact or fiction? Basically, we can say, yes, it works. However, we must consider reductive stress because this is as dangerous as oxidative stress. Therefore, we need to know that reactive oxygen species have detrimental and beneficial effects on sperm. So if we overdo with antioxidants, we actually take the sperm, the ability to react physiologically. They cannot react if they are in a reductive status. We need to know that the balance between reactive oxygen species generation and scavenging is crucial. Classical sperm parameters are not sufficient in diagnostics. That's fine. We can count the sperm, we can count an acrosome reaction, we can see how well the sperm binds to a zona, no problem. But what is the sperm function and the reductive status about? We don't even test it. There's no test available. There's only some groups started testing the total antioxidant capacity in the semen recently. But this is also not a standardized test, and we still have no clue what is really going on. What is normal there? In the end, we need to know that antioxidant treatment must be done carefully, not in order to overdose a patient. It must be in balance. In the end, we have to take the redox status of the patient individually into account. Thank you very much for your attention.